I'd like to ask for your permission to use this video for educational purposes on the internet.
Absolutely.
Now, you had a surgery in 2015. Tell me about what were the symptoms before that surgery and what happened at that time in 2015?
Well, my back kept slipping out,
Mm-hmm.
and I couldn't work because every time I'd start working, pop, there it goes, and I was on my knees crawling out.
Yeah, and you had pain, high-grade pain, up to
Right.
1 to 10. How bad was the pain?
Oh, that was like 9.
9. And you were diagnosed elsewhere, actually in Sioux Falls, and then finally you got a surgery. Tell me about your experience from that surgery, and just to mention it, that was a regular old-fashioned kind of surgery that is still 80% of the surgeries performed in the United States are that way. But tell me about your experience with that surgery.
Well, it was not a good one. A long time healing, a lot of pain.
How long did you stay in the hospital?
I think it was 5 days.
5 days. And how long did it take for you to be really able to walk independently and go about your basic daily activities?
I'm thinking it was close on a month.
Close in a month. Now, and you still had some symptoms afterward. Okay, even you had to go back to the hospital and because of the pain and all the other symptoms. And this has been going on since 2015. Is that correct?
Yep.
How are you dealing with it? How are you coping with it since 2015?
It's not easy.
Yeah, I know.
It's been difficult, to say the least.
Yeah.
It's almost broke our marriage up.
Oh, yes.
It's done bad things.
And it does. When people are in pain,
Yeah.
that doesn't bring the best of people out, and this has consequences for family, for our environment, for our work, and so on. So, but this has been going on, and as a matter of fact, I treated, I believe, your father and mother-in-law.
Yes.
Okay, and that's why you came here, because
That's
you
why.
didn't want to go to any surgeon anymore.
Nope.
Why didn't you want to go to any surgeon anymore?
I didn't want to go to any more surgeries because it was just too much pain, too much suffering,
Yeah.
too much drugs needed
Yeah.
to control the pain.
But yet, you came here because they told you, please go and just check that out.
I've seen their turnarounds.
Yeah.
From the time they had their surgery till they were fine.
Okay. So what did you notice for difference?
It was much faster.
Mm-hmm.
Their turnarounds they made it look like it was easy comparing to my experiences.
Now, your experience, unfortunately, is nothing unusual. Open surgery is just that way, and it's much more damage that your body have to deal with. Now, you came to us, we noticed actually some of the screws were broken, and your fusion didn't take, but on top of that, we checked it out. You had more problem now. You had 2 other discs that they were in a really bad shape, and we said we are going to fix it out. And because you had broken screws there, sometimes that's not an easy thing to take those screws out. But yet we decided the best way to do that, instead of trying to drill around it, take them out, try to bypass it. This is not always an easy task to do. But yet, we talked about that, we may have to open it, but we ended up not opening it. We did it all as a minimal invasively. We did a 3-level fusion, and we bypassed previous broken screws. And if you'd like to come here, I'm going to show exactly what we did. Now, if we go top to bottom, this is up, down, front, back, and you have some electrodes there for pain management and so on. But the concentration is here where we put the spacer here in the 3, 4, 4, 5, and even here in the 5S1. And then this is the broken screw that was retained. And instead of drilling around it, what we did, we just bypassed it by putting a screw next to it. And here, in the what we call bottom-up view, you see these are the screws that we put in, and they literally here, if we go here, these are the screws that we put in. They just go outside of the previous screws that stop right there, on this side and this side. So we could do all that surgery minimally invasively with smaller incision. And to my best knowledge, you stayed only just 2 nights in the hospital. But overall, tell me what is this. How was it?
The recovery was much faster than what I remember with other surgery.
Yeah.
Um,
How long did it take you for you, first of all, how long after the surgery did you walk?
it was just about right away when I started
Same day?
walking. Yeah.
Yeah. And how long after surgery do you think you were doing your basic daily activity?
A week maybe.
Yeah.
Till I was up and running around
Yeah.
doing stuff.
But you told me something that really made me happy, because that is truly where we are to take care of our patient. 2 weeks after the surgery, did something happen that you didn't really think it could happen? What did
Yes.
you do 2 weeks after the surgery?
I was able to walk my daughter down the aisle without use of a cane.
Okay, and that is, after open surgery, it is a rare thing for people to be that independent. And these small things are really what makes our surgery special, because we cause much less damage that your body has to recover from, and that's all what's to it. As well, you told me something that it's a little very unusual, that after your initial pain medication, you didn't even refill it. I know you're a tough man, and that I
Didn't
had
refill
you. Yeah, but that is literally most of the time. No matter how tough people are after open surgery, that would be almost impossible.
Yeah.
Because people need this for months after
Yeah.
the surgery. Now, overall, comparing the old-fashioned surgery to this surgery, what is overall? How would you summarize? What was different?
There's not even a comparison. There was just way more time with the old style surgery.
Mhm.
This minimally invasive surgery is so much better.
Yeah.
It doesn't even compare.
Yeah, and as well, many times as well, that not only that it's easier path there, but that path as well is faster to get where you want to be. Now, unfortunately, bone doesn't heal you're just 1 month after the surgery.
I still hurt, I won't kid
Yeah,
you, but
yeah.
I sure feel a lot better than I would have.
Yeah. Well, thank you so much for
Thank
the
you.
interview. Okay, thank you.